In my ENT world, a head and neck mass is something to be concerned about until it's not. So let's go over what a head and neck mass can be. One thing it can be is nothing. Another thing that it can be is something. So let's talk in generalities. Let's say hypothetically you're an adult and you come see us because you have a head and neck mass. Well, it's good that you've made the first step, which is coming in to see us, because as an adult, anything that pops up in your neck needs to be looked at. Now, if we're talking about a child, there's a whole host of things that it could be, but ultimately, that's what our specialty is named for. Our specialty name is otolaryngology, head and neck surgery. So if you ever feel something in your neck, if something doesn't feel right in your throat, in the side of your neck, or in your nose, that's why you come see us, because we are the experts when it comes to anything in the head or neck. So there are different types of masses that you can have in your head and neck area. One mass that's very common is a thyroid mass. That sits low in the neck. 9 times out of 10 it is benign, but that's why you come see us, because sometimes it's not. Now on the whole, most thyroid masses, you typically will need an ultrasound, followed by some sort of biopsy if necessary. But the most important thing is getting into the office, because if one, your primary care doctor has found something, we're the specialists that can take care of it. And then 2, if it does need to be taken care of, we're also the specialists that will take care of that. In addition, there's other areas of the head and neck that you can have masses. One is also salivary glands. You have 4 major salivary glands, 2 here, these are the submandibular, and 2 on the side of your face, those are called the parotid glands, and you can develop masses in those. Again, a lot of times these are benign masses, but they can be cancerous. And again, if you ever feel one, or if your regular doctor finds one, you need to come see us, because then we can take care of it appropriately. Ultimately, and the thing that most people are concerned about, are masses in the neck that are cancerous. And the most common cancer in the head and neck area is something called a squamous cell carcinoma. And in this day and age, the most common reason for that is some sort of cancer from the tonsil or the back of your tongue. And it tends to show up in people in the ages between 30 and 60. It doesn't mean it can't happen sooner or later after those ages, but again, that's the main age group that it does occur in. And again, we are the specialists that would take care of that for you. Another type of head and neck cancer that can arise is lymphoma. And that tends to be a cancer of the lymph glands. And those tend to be little lymph nodes that will pop up. They stay around for 6 weeks to 2 months, and they just don't seem to go away. And that's when you need to come see us, because again, we're the experts that can identify, is this something that you need to worry about, or is this something that we can just say it's okay? The most common way that people will identify if they have something wrong in their neck is that they will feel it. Either they'll feel something just a little off when they swallow, or they're looking in the mirror and something doesn't seem right, or they're just feeling their neck and they feel a lump. That's the most common way that people will feel something or see a mass. Most of the time, patients will then go to their regular doctor, who will do a good exam, and if they feel like it's necessary, then you'll come see us. Once we've identified that there is a mass in your neck, whether that's in the parotid gland or in your neck, or it's technically in your thyroid gland, there's multiple ways that we can look and work up these things. One way is with an ultrasound. That's the most common modality of imaging that is used for the thyroid. And that's something that we can do here in our office. Other types of imaging that can be done are CT scans as well as MRIs. And we'll have to evaluate exactly what's going on before we would determine which one of those imaging techniques we would use to determine what is going on in your head and neck. Other things that we can do are biopsies, which would determine, is this mass a cancer? Is this mass not a cancer? And that, again, is something that we can do. Specifically for the parotid gland, or a lymph node in your neck, or a thyroid nodule, these are all things that you can use an ultrasound for to do a biopsy in the office.